The hip joint is a synovial joint because there is a joint cavity, and a diarthrosis because it is freely movable. As a diarthrosis, it is classified as a ball and socket joint because the round ball of the head of the femur fits into an obvious socket, the acetabulum of the os coxa. And so the hip joint is an example of a ball and socket joint. Ball and socket joints are the most mobile joints of the body. They allow for movement in multiple planes. So, for example, the hip joint allows for the abduction of the leg as it moves away from the midline of the body, and the adduction of the leg as it moves towards the midline of the body. The hip allows for the flexion of the thigh and the extension and hyperextension of the thigh. Note that the thigh flexes anteriorly. It is extended when it is in anatomical position, and it hyperextends posteriorly. Now, the knee flexes posteriorly, and so it is a bit confusing when one studies the muscles which move the leg. But the hip joint flexes the thigh anteriorly. Ball and socket joints are referred to as multiaxial because they allow for movement in multiple planes, not only abduction and adduction, and flexion and extension, but they also allow rotation, and so the hip joint is capable of both medial and lateral rotation.